the drug working mainly for the heart and the blood vessels. So in these chapters, we mainly talking about some drugs to treat hypertension and also treat heart failure. And we also treat angina and irregular heart rate. Basically, we're talking about these four illnesses and drugs to treat it. So, antihypertension drugs. We're talking about what's the normal blood pressure. Then we're talking about high blood pressure we need to treat. So we say the standard number is 140/90, and by the 3 measurements. Then we diagnosis for the patient hypertension. For hypertension, still have different degree. Basically, by the diastolic blood pressure means the lower part, diastolic. That's number 95 to 105. That's pretty much, and 105 to 115 is middle. Still belong, all of these belong to hypertension, but they just have different degree. And the very severe kind of case, there will be 115 over. So that's different degree. So if patient just diagnosis for hypertension and not that severe, like in the mild stage, so basically we can without medication can treat by other aspects like low sodium kind of food and control the body weight and do some exercises. So that's basically can reducing some blood pressure or control the blood pressure. And certainly if people smoking, try to stop smoking. If people drink alcohol, stop drinking alcohol and do some exercises, relaxing, and reducing eating fatty food. So that's generally will help with high blood pressure kind of patient. Certainly, if patients have very severe kind of high blood pressure, still need thinking about these aspects and help to control the blood pressure. Use drugs same time. So control blood pressure's drug, we go from few aspects. Because blood pressure is decided by how the heart output and how the blood vessels, we talk about terminal heart blood vessels, resistance, and how much blood in the circulation. So that's basically 3 aspects. So we're working with these 3 aspects. I didn't put the blood value here, but truly, sometimes if we try to produce urination, that's basically reducing the blood value in the circulation. So that's we say antihypertension drugs. The first category, pure urination. Pure urination is an effective way, like we reducing blood values. So we say only by these aspects we possible reduce it by 10 to 15, like a pressure in there. And the second category, we're working for sympathetic nervous system, decrease the sympathetic nervous function. So generally speaking, sympathetic nervous system is working to the heart. And they make heart rate increase. When heart rate increase, heart output will be increased. Thus, truly increase the blood pressure. So, and also sympathetic actions also working for the blood vessels. Make blood vessels contraction. When blood vessel contractions increase the blood pressure also. So when we decrease the function of sympathetic action there, truly will decrease heart output and decrease peripheral vessels resistance, and finally decrease blood pressure. And we also can directly working for the blood vessels, dilate the blood vessels. We're talking about the same amount of blood in the blood circulation. When we dilate blood vessels, certainly the pressure will be decreased. And another aspect is we especially working for that's a special kind of hormone we say it mainly working for blood vessels, make blood vessels contraction. Blood vessel contraction like opposite side here, make it narrow. When it makes it narrow, the pressure will be increased. So we try to inhibit these hormone function, similar like dilate to blood vessels. So that's the few herbs we're working for the hypertension from different aspects. Then we're talking about herbs or drugs used for the heart failure. And we special talking about one kind of heart failure that's more commonly congestive kind of heart failure. Means the blood retention inside the heart for different reasons. So in these kind of situations, the heart output will be decreased and not enough blood circulation to the tissue, not enough oxygen circulation to the tissue. The common reasons, heart itself have some illness. Hypertension can cause heart muscle. So the first one is the heart blood vessels disorder. And the third one is heart muscle disorder, like some infections. And also can cause the valves inside the heart disorder. So different reasons can cause the heart failure. So basically, the way to treat heart failure, we separate the drugs into two categories. One category, directly working to the heart, make heart muscles contractions more stronger, more effective, because in heart failure kind of patient, their heart muscles is weaker, contraction is weaker. So we have some drugs directly making it stronger. And if the drugs not directly working with the heart muscles, that's the category we put without directly working for the heart. So pretty simple. And in the first category, we say the drugs directly working for the heart muscles, making the contractions stronger, still including different drugs. Yeah, different drugs. They working with different ways. And the drugs without directly working for the heart muscles, thus including some for promote urination, thus decrease the blood volume and decrease the blood pressure, and the heart let me easily pump the blood to the circulation. And also dilate the blood vessels, still decrease blood pressure, and still make the heart let me easily to pushing the blood to the circulation, to the artery. And then we still talking about these kind of hormones. When they make the blood vessels contracted. So basically, we need to inhibit pretty similar like last. But the last one directly working for the blood vessels, and these one inhibit these hormones functions and result dilate blood vessels. The third unit we talking about agenda and the drugs. So agenda is the unit basically happens in the heart muscles. They don't have enough oxygen to supply. Heart muscles oxygen supply by coronary artery. So basically, this is coronary artery problem. Maybe spasm, maybe some kind of blocking, and then not enough oxygen sending to the heart. So in this category, the drugs that's pretty useful clinically. We say these drugs basically they can directly relax smooth muscles on the coronary artery. We say these units are big part because coronary artery spasm. We can think about like we see the transfer lines of the coronary artery, and some smooth muscles form the coronary artery here. When we talk about the coronary artery spasm, basically they make the diameter smaller. So that's certainly small amount of blood passing through compared with normal kind of circulation. So when we dilate the smooth muscles in the coronary artery, make it bigger, similar like normal. And then more blood supply. So that's pretty effective kind of drug. And they're working pretty fast. And even you can just you can try, or maybe you just put under the top, and they can working like immediately, and continually about 2 hours. So that's pretty useful. Like we can use like an emergency kind of drugs, especially for people who have like some chest pain kind of history and their coronary artery have some problems there. Even hypertension kind of patients pretty easily cause coronary arteries spasm. And then we have some other categories. We have beta receptors blocker. We know that belong to adrenaline kind of receptor. We have alpha and beta, but generally say they try to increase heart rate. That's basically cause the use more oxygen for the heart muscle. So now we don't have enough oxygen. We try to decrease the heart rate, decrease the heart muscle contraction. And some other reasons also can cause these problems. Like some people over exercising and big emotions can trigger adrenal patterns. So generally we say anything like exercises or emotions, they both increase the heart rate and increase the blood pressure and make the heart muscles contract stronger. So that's basically through the sympathetic nervous system. So that's why we use beta receptor breaker, so we can prevent the adrenal attack. And we also use some other drugs still can working for adrenal kind of situation. Basically, it's kind of other broker. So like calcium channel broker. Calcium play a more important functions for muscle contraction. Not only for not only for heart muscles, also for generally muscles on our arm or leg, that's calcium. They need go to inside the muscles through the channels. If we block it there, so basically reducing some including heart muscles and other muscles, skeletal muscles contraction, and decrease the use of oxygen. And we have some others. Medication still can working for adrenal kind of situation. So in these categories, medication, basically they make blood thinner. Blood is more sticky, they are more hard to move inside blood vessels, especially go to coronary. If they sticky there, they are not easily to move, and certainly they move slowly. When they move slowly, the oxygen sending to the heart muscle will be decreased. So this category of the medication, basically, this make blood thinner, and easily flowing. In this category, I think aspirin everybody is more familiar with aspirin. So basically, this kind of patient can use low dosage and continually or intermediately use and reducing the risk like some blocking in the blood vessel. Then we go to another category. Another category, we're working for the irregular heart rate. So irregular heart rate could be heart rate faster, irregular, could be slowly, irregular. So that's basically happens inside heart because we have a special kind of conductors in there that we talk about. We have a special conduction system inside the heart. As it knows, that's the heart rate figure. Yeah. And AV knows. So basically, the electrical producing in the SA node, and then they send the electrical signature go to AV node. At the same time, they will send it to the artery both sides, and cause the artery contractions same time. Then from the AV node, the electrical sending to both the ventricle. When they sending the both ventricle, then they cause the both ventricle contracted at the same time. Because there's a time space here, so during the same time ventricle contracted, the artery will be dilated. And when ventricle contracted, they will pushing the blood go to the artery. Certainly we have two arteries here. One is the aorta, one is the pulmonary artery. So that's basically the heart conduction system working. So anything happens mainly affected as a node function will cause the irregular heart rate and the rate. So the drugs still mainly some blockers. We say sodium blockers. That's basically relationship with sodium channels. Sodium channels, like sodium, is directly relationship with the electrical happens in the conductor system. So we can use blockers, make it working there. And we also can use beta adrenaline blocker. So that's still through the like sympathetic system and working. And the third category, pulsating channel blocker. That's still relationship with the electrical happens in the heart. It especially decrease the sensitivity of ethanol and AV function and the calcium channel blocker. Similar like we talked about last illness, they blocking the movement of calcium ion through the channel. The last category is a kind of special kind of medication, like tolerance. That's a category of the medication. The common drugs with the decoxy. Decoxy is pretty commonly used clinically to treat heart illness. And small dosage and big dosage, the reactions may be little bit different. But generally say they directly working to the vagus nerve that we talking about last week. That's the number 10 spinal nerve. It controls most internal organs function belong to sympathetic nervous system. And finally last week, we go to the drugs treat hypertension. I separated here. Please tell you don't confuse it with hypertension. Yeah. Hyper is low, hyper is high. And shock. In shock kind of condition, most people go to hypertension, means low blood pressure. And in this kind of situation, they need opposite treatment for hypertension. Hypertension will decrease heart pressure, hypertension will increase heart pressure. So that's including increased heart values and increased activity of the heart. So if we try to increase the value of the blood, we can give the patient the whole blood, or maybe the plasma. The plasma is mainly without cells. So in the blood we have white blood cell, red blood cell, and plasma. So plasma is now without blood cells, but still can increase the value of the blood. And we can give others kind of liquid things is increase the value. And we also can use some drugs working for the blood vessels, make blood vessels contracted. So basically we say treat for hypertension is opposite treatment for hypertension. Hypertension, we dilate blood vessels. Hypertension, we contraction blood vessels. So make the blood pressure increase. And certainly we can use some sympathetic kind of similar drugs. We talked about adrenaline and non-adrenaline before. And we also can use like some drugs. We try to with the anti-deurination. So that means reducing the urination. And this truly directly working for the blood vessel, make the blood vessels contracted and increase heart pressure. And with a shock kind of patient, mainly don't have enough oxygen support to the tissues and cause a series of the symptoms like less urination and even can cause heart failure and even mental confusion and terminal is pretty cold and even coma means losing consciousness. Most people, they say most people will be hypertensive, but not all of them. Yeah, it's depending what cause. So we diagnosis for shock is not diagnosed by the hypertension. So basically we see other symptoms together and depending different kind of shock, we treat with different kind of drug, like what's the cause. That's from last class. Last class the drugs let it be simple. Let it be simple. They are not truly got that detail. We just got some basic idea, different illness and how we treat it. So now we go to a review about this.
Cardiovascular drugs. Before we talking about cardiovascular drugs, we need to know how blood circulation first. The blood circulatory system, cardiovascular system, delivers nutrients and oxygen to all cells in the body. It consists of the heart and the blood vessels running through the entire body. The arteries carry blood away from the heart, the veins carry it back to the heart. The system of blood vessels resembles a tree. The trunk, the main artery, aorta, branches into large arteries, which lead to smaller and smaller vessels. The smallest arteries end in a network of tiny vessels known as the capillary network. There isn't only one blood circulatory system in the human body, but two, which are connected. The systemic circulation provides organs, tissues and cells with blood so that they get oxygen and other vital substances. The pulmonary circulation is where the fresh oxygen we breathe in enters the blood. At the same time, carbon dioxide is released from the blood. Blood circulation starts when the heart relaxes between two heartbeats. The blood flows from both atria, the upper two chambers of the heart, into the ventricles, the lower two chambers, which then expand. The following phase is called the ejection period, which is when both ventricles pump the blood into the large arteries. In the systemic circulation, the left ventricle pumps oxygen-rich blood into the main artery, aorta. The blood travels from the main artery to larger and
Something happened to the screen?
In pulmonary circulation, the right ventricle pumps low oxygen blood into the pulmonary artery, which branches off into smaller and smaller arteries and capillaries. The capillaries form a fine network around the pulmonary vesicles, grape-like air sacs at the end of the airways. This is where carbon dioxide is released from the blood into the air inside the pulmonary vesicles, and fresh oxygen enters the bloodstream. When we breathe out, carbon dioxide leaves our body. Oxygen-rich blood travels through the pulmonary veins and the left atrium into the left ventricle. The next heartbeat starts a new cycle of systemic circulation. Keep blood normal circulation, also depending blood pressure. What is blood pressure? Blood pressure is a measure of the force that heart uses to pump blood around your body, and also the force of blood against the walls of the blood vessels, known as arteries. Blood pressure reading is based on two measures called systolic and diastolic. The systolic, top, number is the measure of the pressure force when the heart contracts and pushes out the blood. The diastolic, bottom, number is the measure of when the heart relaxes between beats. Mainly influence factors of blood pressure including cardiac output, peripheral vascular resistance, volume of circulating blood, viscosity of blood, and elasticity of vessels walls. Antihypertensive drugs mainly work by these five aspects, such as decreasing either cardiac output or total peripheral vascular resistance or both, and also diuretics, which lower blood pressure by depleting the body sodium and reducing blood volume. Some antihypertensive drug direct dilators blood vessels. Congestive heart failure occurs when the heart muscle doesn't pump blood as well as it should. Certain conditions, such as narrowed arteries in the heart, coronary artery disease, or high blood pressure, gradually leave the heart too weak or stiff to fill and pump efficiently. Not all conditions that lead to heart failure can be reversed, but treatments can improve the signs and symptoms of heart failure and help patient live longer. Drugs used to treat heart failure can be broadly divided into two categories: drugs with positive inotropic effect and drugs without positive inotropic effect. Drugs with positive inotropic effect increase the force of contraction of the heart muscle. Drugs without positive inotropic effect will through diuretics and vasodilators reducing heart load. Angina pectoris is another common issue of heart. Angina pectoris is the medical term for chest pain or discomfort due to coronary heart disease. It occurs when the heart muscle doesn't get as much blood as it needs. This usually happens because one or more of the heart's arteries is narrowed or blocked, also called ischemia. Drugs used in angina pectoris including organic nitrates and beta-adrenergic blocking agents. The effects of nitrates are mediated through the direct relaxant action on smooth muscles of coronary arteries. It will increase in coronary blood flow and increased oxygen to the heart. Beta-adrenergic blocking agents will block the effects of sympathetic activity such as increase in heart rate, increase blood pressure, and myocardial contractility, then indirectly decrease oxygen using by heart. Normally heart rate will be regular 60 to 100 per minuses. Heart rate controls by the cardiac conduction system. The cardiac conduction system is a group of specialized cardiac muscle cells in the walls of the heart that send signals to the heart muscle causing it to contract. The main components of the cardiac conduction system are the SA node, AV node, bundle of His, bundle branches, and Purkinje fibers. The SA node, anatomical pacemaker, starts the sequence by causing the atrial muscles to contract. From there, the signal travels to the AV node, through the bundle of His, down the bundle branches, and through the Purkinje fibers, causing the ventricles to contract. This signal creates an electrical current that can be seen on a graph called an electrocardiogram, EKG, or ECG. Doctors use an EKG to monitor the cardiac conduction system's electrical activity in the heart. Drugs used in the treatment of cardiac arrhythmias are traditionally classified into two groups, some blockers and digitalis. Sodium channel blockers block sodium channel so that there is an increase in threshold for excitability. Beta-adrenergic blockers will block sympathetic beta receptor stimulation. They will decrease automaticity, weaken AV conduction velocity, and lower the refractory period. Potassium channel blockers depresses SA node and AV nodal function. Calcium channel blockers acts by blocking the movement of calcium ions through the channels. Digitalis causes shortening of the atrial refractory period with small doses, vagal action, and a prolongation with the larger doses, direct action. It prolongs the effective refractory period of AV node directly and through the vagus. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. Lack of blood flow means the cells and organs do not get enough oxygen and nutrients to function properly. Many organs can be damaged as a result. Shock requires immediate treatment and can get worse very rapidly. As many 1 in 5 people who suffer shock will die from it. Antihypotensive drugs are used to elevate a low blood pressure and may increase the volume of blood in active circulation. These include intravenous fluids such as whole blood, plasma, plasma components, plasma substitutes, and solution of crystalloids. Vasoconstrictor drugs will increase blood pressure. It also increases the blood flowing. Sympathomimetics used to elevate the blood pressure include adrenaline, noradrenaline, methoxamine, etc. This is about cardiovascular drugs. Thanks for watching.